The ankle joint is capable of dorsiflexion, which, although technically extension, gets its name from movement towards the dorsum of the foot. The opposing movement is known as plantar flexion, with most of its power coming from the gastrocnemius muscle of the posterior compartment of the leg. The trochlear of the talus is wider anteriorly than posteriorly, and so during full dorsiflexion, the trochlear of the talus comes into contact with both of the malleoli, meaning that the joint is extremely stable when compared to movement in plantar flexion, where the joint is less stable and therefore capable of some rotation. Because the ankle joint mainly moves in flexion and extension, it needs to be supported medially and laterally. On the medial side, there's a very strong ligament called the medial collateral ligament, or also known as the deltoid ligament, which at its apex is attached to the medial malleolus of the tibia. The base is attached to the talus, the cisternaculum tali of the calcaneus bone, and the navicular bone. There are three separate ligaments on the lateral side. These are the calcaneofibular ligament, anterior talofibular ligament, and posterior talofibular ligament. On an injury involving forced inversion of the foot on the ankle, these two ligaments are at risk. The only one not at risk is the posterior talofibula. The foot is arranged into arches which help to take the load-bearing capacity of the foot. These are the transverse arch, the lateral longitudinal arch, and the medial longitudinal arch, which is the most important, and its highest bone is the talus here, which acts like the keystone of a bridge. The medial arch is the most capable of deforming under body weight and directs the forces from the weight of the body to the heel and the ball of the foot, whilst the navicular and cuneiform bones take some of the weight and bounce it back towards the heel. The cornerstone of the lateral arch is the cuboid, and the transverse arch is focused on the cuneiforms and navicular. The most important structure in maintaining the arches of the foot is the plantar fascia, which is a thickening of the deep fascia on the sole of the foot. It's known as the plantar aponeurosis, though of course is made out of deep fascia rather than tendons, and the fascia is called the plantar fascia. Pes planus, or flat foot, is a condition which arises if this fascia is stretched. Inflammation at the posterior part of the tendon is called plantar fasciitis and is quite common, giving rise to pain at the back of the sole of the foot. The ligaments of the foot have to both be rigid enough to support the body's weight, yet flexible enough to allow them to the bones to adapt to uneven surfaces and cushion that weight in form of shock absorption. There are four that I need to know. The spring ligament, which goes from the calcaneus to the navicular bone. The short plantar ligament. The short plantar ligament attaches the cuboid to the calcaneus bone. The tendon of fibularis longus attaches here, and the long plantar ligament attaches into all four digits over the top of it, inserting into the calcaneus. On the other side, the dorsum of the foot, the bifurcate ligament connects the calcaneus and the cuboid bones. But out of all of these, structurally the most important is the spring ligament. That's the most important one. On the lateral side of the foot, the tendons from fibularis longus and brevis, otherwise known as the peroneal tendons, stretch down underneath the lateral malleolus and insert into the fifth metatarsal. They're covered by the superior and inferior peroneal retinaculi. Since they run underneath the cuboid bone, they're crucial in supporting the lateral longitudinal arch and its accompanying set of bones. Now, these muscles of the lateral compartment of the leg not only support the lateral longitudinal arch of the foot, but also go underneath the cuboid bone just to give a bit of extra boost to the transverse arch which goes along this way, consisting of the cuboid and cuneiform bones. Now, if you look at the foot front on, the tendons of fibularis longus and brevis run down the fibula here on the lateral side. Tibialis anterior and posterior run either side of the medial side of the tibia. That's tibialis anterior and posterior, correspondingly coming from the anterior and posterior compartments of the leg. Now, these two tendons converge and do the same thing around the medial malleolus that the lateral tendons do, attaching into the second and third metatarsals, and in doing so supporting the medial longitudinal arch centering on the talus bone. When the tibial nerve reaches the foot, it splits into the lateral plantar and medial plantar nerves. The medial plantar nerve supplies most of the cutaneous innervation of this foot, the medial 3 toes, and half of the sole of the foot. And the lateral plantar nerve supplies the 2 little toes, or the little toe and the next one up, and the other half of the sole, cutaneous innervation. The cutaneous supply to the dorsum of the foot is largely from the superficial peroneal nerve. The deep peroneal nerve only supplies the skin between the first 2 toes of the foot. The lateral margin of the foot is supplied by the sural nerve. Remember, this is a branch of the tibial nerve, having split at the popliteal fossa. The medial side of the foot is supplied by the saphenous nerve from L4. So, as you already know, the popliteal artery divides at the back of the popliteal fossa into the anterior and posterior tibial arteries. The anterior supplying the anterior compartment and the posterior compartment. The anterior continues down to the foot, where it emerges from under the medial malleolus, becoming known as the dorsalis pedis artery, and forms the dorsal arch, where it's also known as the arcuate artery. For venous drainage, the great and small saphenous veins enter the foot, where they're connected in their own dorsal arch. The fibular peroneal artery comes off the tibial artery in the leg, where it also goes down to the medial malleolus. And the posterior tibial artery crosses laterally to become the lateral plantar artery, forming the corresponding plantar arch beneath the dorsal arch being the venous arch, giving rise to medial metatarsal arteries.